Senator Gedeon, you have the floor.
Thank you, Madam Deputy President. As was said earlier, healthcare is of extreme importance to us in St. Lucia. And if healthcare is of such significance, where everyone has a part to play, no one knows when they're going to fall ill and the extent of their illness, except a doctor diagnoses and tells you what you're suffering from. It hurts, Madam President or Deputy President, it hurts. When we talk about health care and we look at the situation that we are now faced with in St. Lucia. And if we are so concerned about the health of our people, it begs the question that if I am concerned about the health of my family, it is a situation where I'm going to pay attention or constant attention to. I'm going to make all the preparations, the necessary preparations, to see that when one falls ill, that the chances of survival would be more than dying. We have in St. Lucia presently a healthcare crisis, as it is so said. We have a healthcare crisis. The health sector, in no uncertain terms, when we look at it, we can realize it is poorly managed. It is poorly managed. I take note that we are strengthening our primary health system. That is what we are strengthening. Again, I point to the why now. Yes, we will say better late than never, but we could have the cross statement in if, as I said previously, we are serious about healthcare, that it had to be a situation where we apply immediate attention. We follow on and we change if necessary. But we can't just come in and we stop. We stop situations that were in progress to better the health system. We right now talk about where $1 million has been spent in paying certain nurses, and now there is no more money, so they have to go home, and so on. We won't be making such statements.
Point of objection. Section 37 of the standing orders. And it says that, subject to the provisions of these standing orders, debate upon any motion, bill, or amendment shall be relevant to such motion, bill, or amendment, and the senator shall confine his observations to the subject under discussion. The subject under discussion is the health system strengthening project. The idea of $1 million in whatever has been done has no relevance to this particular subject being discussed there. The health system strengthening project. This is the subject that we're dealing with.
It looks like I was talking about maybe sports and not health. I was dealing with sports and not health. The session workers are not part of the health sector. They must be part of some other sector. As I was saying, Deputy President, that if we speak about the importance of health care, the necessary tools must be in place. The primary health care, we have for more than maybe 4 years now, ongoing, we had a health center in La Ressource, Dennery. There were monies allocated to renovate and to put it back on its feet so that persons in that area, the valley area from Orleans, Daniel Riviere, and these places could have gone there and get their health needs taken care of. Up to this instance, as we speak, the place is still closed, and these persons, they have to go all over to Richford, and as we said, to see grown persons who we speak about that we are intending to give these machines to look after themselves in terms of the pressure and the diabetes. These individuals leave their homes sometimes 5 o'clock in the morning to walk the stretch to get there, to get a number to see a doctor. Whereas they had the center right within the area, they would have walked in there and get attention. You see, it is nice to come here in this house and speak about nice things, 20 million US dollars. With a broad heading, health strengthening project.
On a point of elucidation, Deputy President.
Section 37.
Standing Orders 36B, Madam Deputy
You were corrected a while ago.
On a point of elucidation.
To which standing order, please?
36B. Okay. Yes, thank you, Deputy President. Thank you, Honorable Senator. I just want to clarify that the issue you mentioned in there about that wellness center, those funds are going directly into taking care of those wellness centers, because that wellness center burned prior to us coming into office. And what we are trying, there was no money left to do the necessary, so we have sourced the funding now so that we can go ahead and fix it. Okay? I hope that has helped a little. It's primary care, health centers, wellness centers.
Okay. It's just funny, very funny. Trying to elucidate and saying the very same thing I said. Okay. So as I was saying, Deputy President, Madam Deputy President, that it is all well and good to come and talk about we are going to get some money, 20 million, to facilitate, in particular, as the Senator said, who is the Minister of Health, primary health care. She made mention that now is going to take charge of the building, so the building is going to be renovated and put in place. And so is the Dennery one will be completed and so on, I hope. Okay? So I am saying that we are coming with this right now when persons have gone through the struggle. Persons have gone through the struggles. And right now, there is a cry about the health situation in St. Lucia. And whilst, yes, we are going to attend to it, I am saying that it should have been a continuous process. And if we talk about caring for our St. Lucians, the way we talk about we are caring for St. Lucians right now, I am saying that from the time we got elected, we would have gone on the move, because we see that St. Lucians are important and they are part and parcel of us, and we need them to continue. We need to see things going on, so therefore we would have done it. So the question is, why now? What happened? What happened 2.5 years before? Why now we have a situation where problems upon problems in the health sector? We hear it every day. We hear it every day. Persons are crying every day that this is not there, that is not there. The health sector is in a mess, and they cannot get medication, they cannot do this, they cannot do that. So I'm saying right now, as the Senator said, that we are hoping that the Larissos Health Center will come on stream, as she said. Well, I'm not too sure for the new health center they plan for Dennery. We have heard our part about it. I've heard my part about it. I mean, I'm not going to even talk about it. She said the St. Jude's Hospital is completely out of it now. The questions I need to ask is why? St. Jude's Hospital is placed in the south, down Vieux-Fort. So I'm hoping maybe when the time is right, she's going to talk about it and say exactly what is going to happen to St. Jude's. She said the building is not under her purview right now, and you've heard so many things. And therefore, we need a concrete statement. We need something serious about St. Jude, which is part of the component of health in St. Lucia. It is not something that is separate. Deputy Speaker, it is not diverse from it.
Under Section 37 of the standing orders, again, subject to the provisions of these standing orders, debate upon any motion, bill or amendment shall be relevant to such motions, bill or amendment, and a senator shall confine his observations to the subject under discussion. I don't see anything on this that mentions St. Jude's.
You don't lead the chair. Let the chair tell me that. You don't lead the chair.
Well, Honorable Minister of Home Affairs, Justice and National Security, I rule that the conversation is relevant because he's really speaking about healthcare, and St. Jude's is a subset of healthcare. So I so rule. Thank you.
Thank you. So, Madam Deputy President.
Deputy President, on a point of order 36A. It's okay.
Let him go, I will deal with him. Yeah, I will talk.
Senator.
Deputy President, if the Senator is making a valid point, I will not interrupt. However, the Senator is talking about St. Jude. St. Jude is a hospital. Primary care has nothing to do with hospitals. We need to get it right. Primary care is about the wellness centers. Dennery is supposed to have a hospital, not a wellness center. So I do not want, Madam President, Deputy President, for anyone to leave here thinking that I am referring to the Dennery Hospital, the Soufrière Hospital, the Victoria Hospital, or any other hospital, St. Jude Hospital. These are hospitals. We are talking about primary care, and it has to do with strengthening the wellness centers, because that is where you talk about, that is the infrastructure you refer to when you are talking about primary care. And this is why I avoided talking of bringing St. Jude into the picture, because the motion is speaking to primary care. Thank you, Senator.
Senator Gedeon, please restrict your discussion, your contribution around the primary health care issue, since this is what is being presented in the motion. Thank you.
I would beg to say this to Madam Deputy President. The motion that is here, is there anywhere in this motion where I can see primary health care or written in there? It was said by the senator. The senator was the one who brought it in. And that is why we said that if you were talking about a system, you need to clarify it in writing so that when I read, I can see that there is what we call the primary health care situation. So if I go out of it, I could be corrected. But it was issued by her. She was the one who said it. Now, am I supposed to just take her word and say, okay, she's just speaking briefly on primary health care? It says $20 million for health system strengthening project. Health system strengthening project. So the health system strengthening project could deal with anything that pertains to health. She decides to speak about primary health care, and she made her point. I can open it. I can open it to Dennery, I can open it to Larissus, I can open it to Richford, because it is broadly saying health system strengthening project.
Honorable Senator, in the capacity of Minister of Health and Wellness, the Minister provided elucidation on this particular issue, and I rule that you should restrict your conversation and your contribution to that aspect of the debate.
So, I'm so guided, Madam Deputy President. Okay. But as it goes on, when these monies will be dispersed, utilized and dispersed, then the truth will come out as to what exactly is termed health system strengthening project. It will be. It will be, and so we are going to deal with this a little. Now, I personally, she spoke about health insurance for all. For all. Now, in speaking about health insurance for all, the question that I beg, will the vagrant on the street, when he falls ill, will he have to go to the hospital likewise and receive a health card or a health insurance card, and then be open to all forms of treatment that falls on the health insurance aspect? Yes. Now, I like to hear yes. I like to hear yes. I like to hear yes, but saying it is one, and doing it is another. Now, this is what we are going to be monitoring. I will be monitoring it. I will be, because I know I have persons in my community who cannot afford, they won't be able to pay health insurance, they may fall sick, and they'll need to go to the primary health care to receive preventative treatment of their disease. And so,
Standing
Madam
Order
Speaker,
36B, Madam Deputy President, Standing Order 36B. On a point of elucidation,
Yes, Minister of Health and Wellness.
I would hate to allow my fellow senator to leave here without the facts. When you refer to the vagrant on the street, you're still talking about a person. We take care of our mentally ill patients. We have mental wellness center. And anybody who is going to be taken there, and every now and then, the people on the street are also taken to these wellness centers. And anybody that's taken to any healthcare institution will be put through a process where they can access, where they will be able to access a healthcare card. That is what national health care is about, national health insurance. And it doesn't, I would hate for you to think that somebody, because the person is a homeless person or mentally challenged person, that the person would be deprived of that type of service. When we say national health insurance, we mean everyone.
Okay, your word is so taken. As I said, I'm going to be judging on your word, and my statements afterwards, thereafter, would be based on what I see happening in my community when the project comes into being. And so, I am going to say that we look forward to the day where healthcare in St. Lucia will be on a footing, or will not be on one limb, but will be able to stand firm, and persons will be able to access and receive adequate health care for the betterment of their health and also that of their family. And so, Madam Deputy President, I will have my eyes opened, and I'm going to be monitoring, and then I will be able to make further input into this $20 million that has been loaned for the strengthening of the health system. Thank you very much.